This in-service training session will teach lab employees about the Duke Lifepoint collaboration and about the National Quality Assurance Program that Ashley Regional Medical Center is implementing in order to achieve affiliation with Duke University in order to improve patient quality of care. Hospitals who achieve this affiliation are able to receive support to continue enhancing patient care for the community. They also receive a host of additional benefits, including financial stability and security, ability to expand services, support to develop new specialized services, support for medical staff, support to recruit and retain physicians, ability to ensure continuity of care for patients through tertiary and quaternary care available through Duke, capital to invest in new technology and services. Achieving this affiliation is considered a journey, not a destination. As the hospital uses the improvement tools provided, it can set goals to complete that will improve and promote active communication, which in turn will improve patient safety and quality of care. These tools are called the Foundational 5. They consist of briefs, huddles, debriefs, learning boards, and executive patient safety rounds. Briefs are intended for the beginning of a shift. It is a time for the team to come together to plan for the day. In the case of the laboratory, any calibrating of machines, timed draws, problems with QC, or other issues that were communicated to the incoming team by the outgoing shift can be addressed, and, if needed, assignments can be made for specific team members to address and resolve. This time to communicate will set the tune and pace of the shift so that unexpected problems don't arise and throw everyone off. Tests can be run and results reported in a timely fashion when everyone has been briefed on what to expect for the day. Huddles can occur at any time of the day to address any problem that may arise. They are typically shorter than briefs and only address the specific problem at hand. These are especially important if a problem needs to be resolved using the collective knowledge of the group. Debriefs can occur either at a specific time, such as at the end of a shift, or after a particular event, such as after solving a problem that required the help of the team, either in part or as a whole. This is a time to talk about what went well, what didn't, and what could be improved. This is a perfect time for the outgoing shift to communicate anything that happened that the incoming shift will need to know to have success. This communication between teams is critical because no one wants to be caught by surprise if a machine is having problems giving correct results or a reagent needs calibration and they didn't hear about it from the previous shift. Learning boards have several functions. They are a place where issues and concerns can be addressed and followed up on over time. They are also a place where ideas to improve the workplace can be presented and considered. Not every idea will be implemented, but everyone has the opportunity to present them. They are placed in one of three categories: identified, in progress, or resolved. As with every other focus in this program, the ideas or issues should be related to patient safety, quality of care, or performance improvement. EPSR is an opportunity for administrative leaders to visit with employees to talk about their concerns and whether they feel safe in their work environment. These are also opportunities to address any difficult issues on the learning boards. Always be happy to join an executive patient safety round. It is one of the best means to have your voice be heard directly. Other tools available include the 5 Whys, Good Catch, and the Culture of Safety and Engagement Survey. The 5 Whys is a technique to explore cause and effect relationships. It is a way to peel the layers of symptoms to arrive at the root cause of a problem. Good Catch is a way to identify an incident that did not reach a patient or cause any harm because of the vigilance of an employee. Identifying these incidents gives opportunity to learn from and correct them so they don't happen again at some future point and perhaps cause harm this time. The Culture of Safety and Engagement Survey is used to evaluate the culture safety level within a facility. It evaluates based on a number of categories, including engagement, teamwork, safety culture, perceptions of senior management, supervisor support, etc. These evaluations are used to identify any problem areas and set goals to improve them. All of these tools are intended to create an environment where goals can be set and accomplished. As the hospital improves, patient satisfaction will increase, which will then cause the patients to return again. As employees, we can take pride in our work and the efforts we put in to engage in these practices and see the efficacy of our lab increase and know that we are helping the hospital and the community.